Welcome back to Sarah Has Questions. Today, we're talking sober curious. Have you ever done a dry January or sober October? I have. And did I feel better? I sure did. There are a lot of positive things it does to our bodies. Let's talk about it. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? Will popping a knuckle or a joint give us arthritis? What can we learn from our poop? The size of your body doesn't necessarily indicate your measure of health. Yes. And what are your thoughts on that? Cleansing. Do we need to do anything special to our nether regions? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. Today I have Dr. Christopher Thompson. He is an addiction medicine physician with WakeMed. Welcome. Thanks so much for coming in today.
Thanks. I'm glad to be here.
Sober October is something I keep hearing about, and Sober Curious on my Instagram and social media. I keep seeing all these these alcohol-free liquors. Where do you think all this is coming from?
Yeah, it started out about 10 or 15 years ago out in the UK with Dry January. So it was part of like New Year's resolution. It was like challenging, your friends and your family, to kind of be, alcohol free or to kind of live a different lifestyle and just being mindfulness of how much alcohol that they're using and how it's affecting their health and how it's affecting their well-being.
And it feels like it's just grown exponentially.
It has. Social media has really kind of pushed it, out to a wider audience. And of course, the new generation of folks are, coming up, and some of the teenagers that are now, legal drinking age are now realizing some of the risks and benefits of not using alcohol is really important to them.
Yeah.
And these online challenges, everybody's like, oh, Dry January or, Sober Februaries, and every month has some sort of
moniker and
challenge.
Yeah, you can turn any of them into favorable February.
Yep.
Yeah.
There's some books being written, Sober Curiosity is a big one that's out there. Just being mindful and just a lifestyle change. A lot of new entrepreneurs are coming out with these mocktails and these changing lifestyles where you don't need, alcoholic beverages at every event, like weddings and open bars are not as big of what they used to be in the past because people are being more conscious of their health and their finances going through.
So. Well, yeah, finances for sure. An open bar is a pretty big price tag. Is there any benefit from having a dry whatever month you want to put in there? Does it even help?
Yeah, oh, absolutely. People can see a big difference in their health in just 30 days of being abstinent from alcohol. They improve sleep, improved memory. Weight loss is a big thing.
Yeah.
You'll be surprised how many calories are in, an alcoholic beverage. And then, so cutting all that out, you can drop usually several pounds in over a 30-day period. But you sleep better.
Why do you think that sleep is affected? What is it about alcohol that affects your sleep?
Alcohol, it affects your REM sleep. It doesn't allow you to get that deep sleep that regenerates your body and helps with your memory and kind of processes, what you did the day before, and then being refreshed the next day and being able to start your day off in a very more relaxed way, not hungover, not having headaches.
Right.
So a lot of neurological effects as well.
So what is it about alcohol that gets in the way of REM sleep? Do you know that answer? Okay. Can you tell me, doctor?
Well, yes, we'll get a little scientific here. This will be. I
want to get in the weeds a little bit. I'm curious.
So we have GABA and glutamate in our body. That is our inhibitory and excitatory part of our nervous system and our way our body reacts. So when we drink alcohol, it's a depressant.
Okay.
Right. So it depolarizes our nerves and really relaxes everything. And
Which is why people like drinking.
Right. We get some those are the positive effects for alcohol. Yeah. And if we use alcohol at lower amounts and stick with our, daily limits and our weekly limits, there are some positive benefits to alcohol. The problem comes is when we use excessive amounts of alcohol, our body tries to compensate. So the other side of that inhibitory part is the excitatory part, and glutamate part of our body. Again, it's kind of neurotransmitters in our body, receptors in our body that kind of upregulate to kind of help with kind of all that negative effects.
So what does it do to upregulate?
It just over time, it produces new receptors, and we get more receptors, on our neurons.
Okay.
That when we remove alcohol and we don't drink, that's what causes the withdrawal, because we have this unopposed excitatory response in our body. And that what causes the really bad side effects of using alcohol, like seizures, DTs, deuterium tremors.
Oh, yeah.
For folks that, really excessively use alcohol.
Yeah.
They have this really high upregulation of these receptors. So when you remove alcohol suddenly, you get really severe withdrawals.
So if you were to remove alcohol for like a extended period of time, do those receptors go away?
They do. Yep.
Where do they go?
They just disappear. They just deregulate. That's what's so fascinating about our body.
That is fascinating.
Is our body doesn't like to be in that intoxicated state. So it really changes its structure so that it, we still have the effects of alcohol. We're still intoxicated. It still, decreases our reflexes and our ability to perform.
Sure.
But it really it doesn't like that, so it upregulates. And then when alcohol is removed, even with that 30 days of a dry January, those receptors will start to go back down and kind of get back into equilibrium.
Interesting. When you're talking about these withdrawal effects, a hangover is withdrawal, is it not?
Yeah, I mean, we look at a scale for withdrawals.
Okay.
Called the CWA scale.
Okay.
We can kind of measure, what your kind of withdrawal symptoms are.
Did you say Seawall or Seawa like
Seawa.
JoJo Siwa?
Yeah.
I wonder if that's where she got her name from. I'm sorry. Go ahead.
But we have those scales that we can kind of look at the withdrawal settings. And, the standard hangover of, headache, fatigue, upset stomach, sometimes some diarrhea. Those are, kind of common withdrawal symptoms. The more severe withdrawal symptoms would be seizures and, more chronic liver disease and other properties that kind of more of a chronic effect on your health that can lead to more severe withdrawals. And some of it is relative to how much alcohol we consume.
Okay.
But everybody's a little bit different. So some people can have those severe withdrawals with just even having, a little bit over the amount.
Interesting. Maybe they have like more receptors just pop up quicker. Yeah. I noticed you said using alcohol as opposed to drinking alcohol. Is that something?
We're trying to change the terminology, trying to change the stigma.
Okay.
We're really considering, alcohol use disorder as a medical condition.
So talk to more about that. So it used to be called alcoholism, right? Now you're calling it alcohol use disorder. Why the change?
A couple of different reasons for the change. And the biggest one is to kind of reduce the stigma so people can go get help and treatment if they need it. But we look at alcohol as a chronic disease. When we get to the point where we, use excessive alcohol and we form an addiction, that is considered, a chronic disease, and you need medical attention to help, reduce your alcohol and to live a healthier lifestyle. We talk about there's genetic factors to alcohol use disorder. Usually somebody, if they have an alcohol use disorder, they have a 50% chance that one of the first degree relatives also, has addiction.
Do we know why?
There are some studies in genes and different alleles and the expression of our DNA that lead folks, into addiction and alcohol use. And there's also some genes that actually protect people from alcohol use disorder.
Like, in what way would they protect it?
Because if people, get sick if they consume too much alcohol. Some people can't process alcohol. They can't metabolize alcohol as much or as fast. So the more they drink, usually kind of
the worse they feel.
The worse they feel,
yeah.
And not just through the intoxication or through the withdrawal, but the actual consumption of alcohol. They get flushed, they get sick to their stomach. They just don't feel really well, when they consume alcohol. So they just tend to avoid alcohol because they don't get those positive effects that many people do.
So what I'm hearing you saying about the receptors I found very interesting. I'm glad we got in the weeds.
Yeah, we're in the weeds.
So how do you know you have an addiction?
So there's a lot of different ways that we can kind of go about it. A lot of
Okay.
it is just kind of if it is affecting your overall health, and lifestyle. So we know what daily limits are. We know what kind of the recommended limits are for alcohol.
Mm-hmm.
And, the first thing we need to look at is kind of what a standard drink is. Because people don't even know what a standard drink is that's defined when we talk about how many drinks we can have in a day. And it's a really small amount.
I bet. So, yeah, what is it?
So it's 12 ounces of beer. And
Okay,
that's
one can.
One can, and it's your traditional beer between 4 and 5% alcohol.
Not a craft beer at 9.5%.
Correct. And
Gotcha.
those craft beers are really becoming more popular, especially in this area. And we have to be aware that they do contain a lot more alcohol. And they don't come in 12-ounce cans anymore.
Oh, no, they're big.
They're big. You can get them in 24, 25-ounce cans.
Yeah, sometimes I say it's not a drink, it's a challenge.
Correct. Yep. And like 40 ounces. And,
Oh, yeah.
Yeah, there's a lot of different sizes of beer out
Sure.
there. But the standard size for a can of beer is 12 ounces.
Okay.
For wine, for normal table wine, about 12% alcohol, it's only 5 ounces.
Well, I used to work in restaurants for a long time, and I couldn't tell you how many times we were taught to pour a 5-ounce pour, and people would get so upset with us because they're like, "You didn't fill our glass." I'm like, "That's actually a serving of alcohol because you have to price it out."
Yeah.
So yeah, it is. It's real small compared to
is.
what you normally like. The grandma pour most people give themselves on Friday night.
Yeah, and then you look at liquor, and it's only 1.5 ounces.
Not even 2 ounces, which is the full jigger whenever you're making cocktails.
Correct. Yeah. So it's 1.5 ounces of 80 proof
Oh yeah.
spirits or liquor, and even an airplane bottle is 1.7 ounces.
So it's more than.
So it's more than
Oh,
a standard
interesting.
drink. Yeah.
Well, and I know a trick to find out what the proof is, and that is like whenever you're looking at a bottle of alcohol and it says 40% alcohol, you just double that, and that's the proof of the alcohol. So there are some. I know there's one bourbon called J.R. Hirsch that I think is like 100 and something proof.
Yeah, just like we talked about craft beers, liquor is also getting higher proof. Wild Turkey 101
Oh yeah.
and all the other bourbons are, higher proof, and those are the ones that are sought after.
Okay.
Right? So now you're looking at maybe less than 1 ounce is considered a serving.
Okay. Well, I bet a lot of people are over-serving themselves. I can tell you right now in this conversation, I definitely have 2 servings of wine in one glass most often.
Yeah. So you really have to define what that is to patients because they don't really know how much they are consuming because they don't understand what that kind of.
So where do these serving sizes come from?
So the servings that comes from federal government and regulations of what healthy consumption of alcohol can be, and not just so now that we define what a standard drink is, then we also have to define how much we can consume.
So just a way to measure it.
Yeah. So for women and men older than 65, it's no more than 1 drink per day and less than 7 drinks per week. And then for men under the age of 65, it's no more than 2 per day and no more than 14.
Okay. Yeah. Oh, interesting. Okay, so binge drinking.
Yeah, binge drinking.
And so anything over those limits is just considered binge drinking?
Yeah, so binge drinking for men, it's more than 5
drinks a day?
standard drinks in one sitting.
One,
drinks a day. Yep.
Okay.
And then for women, it's 4.
Is that irrelevant of the length of time?
Typically, they say in 1 day in a 24-hour period.
Okay.
But typically, it is in a short period of time
Yeah.
in the evening or in one sitting.
Okay. Well, that's the thing. Like if sometimes you can have like 1 drink an hour. Say you're at a wedding, it's like a 6-hour event,
Yep.
and you're having. And I've heard in the past that your body will digest essentially 1 serving of alcohol an hour. So if you were to have 1 drink an hour for 6 hours, that's still considered a binge drinking session.
Yeah, your body's really working overtime. And, everybody metabolizes alcohol at a different rate.
Okay.
Women a little less than men. That's why those limits are
Another
lower.
thing that
Yep,
we just got
another
to
thing.
put
Yep.
up with being
Exactly.
women.
Yep. But, we tend to metabolize. It's approximately 1 drink per hour.
Okay.
But again, if you drink that first one, your body's still metabolizing that first one as you're consuming that second one within that first hour. So you're basically stacking.
Sure.
And that's what causes the intoxication and those higher levels of alcohol in our body, which can be, toxic to our GI tract and to our pancreas and to our liver and can really have more effects. Plus, we really talk about risky behavior when someone consumes that much alcohol.
Oh, yeah. Most certainly. When we're saying addiction, Is that just trying to get back to like getting those receptors met and then not having seizures and terrible things? Is that like the definition of addiction? Like what exactly is
Sure.
addiction?
So, you have these social drinkers or social alcohol use where they kind of, on the weekends, weekend warriors, as long as they kind of stay below those binge, we didn't talk about
We're getting
binge
there
drinking.
next. We're getting there next.
But if they're kind of just using alcohol socially, that's fine. Using it for those positive feelings and those, help relax and reduce stress, can be, beneficial to
nice,
folks.
yeah.
The problem is when you do exceed those limits, and you do build up those receptors, what happens is then you start sometimes consuming alcohol all day or early in the morning, call it an eye opener, because you're trying to prevent those withdrawal symptoms. Your
Okay.
body builds this physical dependence on alcohol. And if it's not there is when you get those severe withdrawals.
And that physical dependence are those receptors.
Correct. Yep. And then they have to use alcohol so that they don't go into those severe withdrawals. And you get into this, that's when you need medical treatment.
Okay.
Is really when you get to that severity of alcohol use. You can't stop alcohol. Severe alcohol withdrawals can be fatal.
Why would it be fatal?
Because of the seizures, because of that unopposed excitatory DTs. It really has an effect on our body, again, through those mechanisms that we talked about, to actually lead to death.
So if you're an addict and you've gone a couple of months without a drink, and then you're like, I'm renting a hotel room, I'm doing this, I'm going to drink a lot. Why would that relapse? Most often I find that like Amy Winehouse comes to mind. She had been sober for like a year and then she had a relapse and she died from it. Why is the relapse so dangerous?
You have memories, again, people use alcohol for those positive effects, and those positive effects make you feel good. And if you have those pathways that are built in your brain, or something, again, more in the weeds, we have neuroplasticity of our brain. So when we use alcohol, the mid part of our brain or the limbic system of our brain forms memories of using alcohol.
Oh.
And their bodies like alcohol. So even if you're in recovery, and again, we talked earlier about it, it's a chronic disease. It never leaves you.
Right.
So
you're always going to want to
correct.
somewhere.
Yep,
Yeah.
You're always going to have those thoughts, feelings, and memories of those positive effects of alcohol.
Gotcha.
So even if you're sober for months, years, decades, right? A lot of times it doesn't start with, hey, I'm going to rent a hotel room and just
Drink myself.
drink bottles and bottles of wine and beer. It starts with one sip. If you're at a wedding and you have that champagne toast and you get that taste, all those memories flood back into you about all those positive effects, about all that addiction. And sometimes it just takes one sip and they can't stop.
And so then they go and they just drink all night long.
Yep.
And
or it just starts with a sip, and then the next day they just have, oh, that was really good last night. I'm going to have 2 tonight.
I can
and then
handle
3.
it.
I can handle it. And then it many times will get out of control very quickly again for someone that's in recovery.
So, and is it like the damage you had done to your body before, like your body just can't handle it again kind of thing? Is that why they die? I've always wondered this, why relapses seem so dangerous.
So you do build a little tolerance, again, with those upregulation of receptors, with, your enzymes in your liver, and you kind of can process alcohol a little bit better when you are chronically using alcohol, where if you kind of return to use quickly, your body's not able to process as much as fast as quickly, so you get intoxicated faster.
I see.
That, right? But a lot of times there is some health, liver cirrhosis and some other things if you're a real heavy user of alcohol prior to. But it's really just kind of those same effects it just kind of comes back, in full force.
Gotcha.
So we talked a lot about early on is the receptors and there's medications that we can use for alcohol use disorder. Yep. So there's 3 FDA approved medications that we can use for alcohol use disorder. That can be used to either limit the cravings for alcohol use, to kind of help with some of those receptors. Then, there's one disulfiram that'll actually make you ill if you consume alcohol.
Oh, okay. Like a Pavlovian effect.
Yep. A lot of people know that one, the disulfiram. It's an older medication that you take it every day. It's a pill. And then if you consume alcohol, it just makes you really sick.
Okay.
But again, we don't use that as much anymore because it does make folks ill.
Sounds miserable.
It does. If someone has some comorbidities, it can lead to more health effects if they have heart disease or.
So it's a little dangerous.
It can be. They have to be under medical supervision if they're going to use that kind of medication.
What are the other ones?
Mm-hmm. Yep. So one is acamprosate.
Mm-hmm.
Acamprosate kind of works, on that GABA receptor system.
Okay.
And glutamate receptors that we talked about to kind of help kind of regulate those cravings and urges to use.
Okay.
So those are some big ones. And then kind of the gold standard is naltrexone.
Okay.
So naltrexone comes in a pill and also an injectable form.
Mm-hmm.
The injectable form is called Vivitrol.
Mm.
And that tends to be the gold standard now for alcohol use disorder.
I see.
So that kind of helps reduce those kind of positive feelings, when you consume alcohol. So you just lose the
you just don't feel
you
good.
Just don't, no, you just lose the kind of the taste for it. You just, when you use alcohol, it doesn't give you those positive kind of reinforcements.
Okay.
And you just like, I can stay away from it. It doesn't do what it used to do.
The thrill is gone.
The thrill is gone. That's a good way to put it. Yes.
Yeah. Mm-hmm. Okay. I have a couple of friends in my life who are in recovery, and one went through AA, and one went through Smart Recovery. And the Smart Recovery person believes that addiction is something that you can mind your way out of. What are your thoughts on that?
So all of those peer-run groups that are out there,
great support systems,
awesome,
vital.
Yep.
So do you think that someone who's a big alcoholic can will their way out of it?
So again, those medications kind of help on that kind of midbrain, that limbic system, all of that stuff. But a lot of our judgment comes from our frontal lobe, or our executive decision making of our brain. That's where folks kind of make that decision to continue to use alcohol, or if you talk to folks that use a lot of alcohol, they know it's harmful for them, but they keep using, right? And they keep drinking, and they keep putting themselves at risk, even if they have health problems. They just can't stop.
Yeah.
And part of that's that executive. So everybody has triggers to use alcohol, and they need coping skills. They need better coping skills than reaching for a bottle or reaching for a drink.
Yeah.
And that's where our therapy comes in. So there's many different types of therapies. You can have therapies from a therapist and a provider-run either individual therapy or group therapy.
I'm a therapy proponent. I love therapy.
Yeah.
It's
Therapy
the
is
best thing
great.
ever.
Yep.
Who doesn't want to talk about themselves for an hour?
Right. And it really helps get down to the kind of the root cause about why you started using alcohol. Find what your triggers to use alcohol are. Figure out coping mechanisms. When you're thinking about alcohol or thinking about picking up a bottle, what else can we do?
Yeah. I mean, that's the hard part. All right. Well, let's move on, because from what I understand, this is a 4-question quiz. And if you get more than 2 yeses, 2 or more yeses can indicate alcohol use disorder. I'm nervous, but I'm willing to take it. So I'm sure you don't have to have them written down. There are only 4 questions.
I probably do, but
You've got them. This is what you do.
So I think what you're referring to is what we call the CAGE questionnaire.
Okay.
CAGE. So have you ever tried to cut down unsuccessfully with your alcohol use?
That's the first question?
That's the first question.
Oh, okay. Have I ever? An unsuccess. Yeah, I guess yes is that. Yeah.
Yeah. Okay. And then, the A is, do you ever get annoyed when someone kind of comments about your alcohol use, or maybe tells you that you probably need to stop using as much alcohol?
I haven't had that told to me.
Yeah. Okay. Do you ever feel guilty about your alcohol use?
That's a trick question. I grew up Catholic.
Yeah.
So I feel guilty about everything. So yes is the answer, but I also feel guilty when I eat a cookie. So,
That's hard.
Okay.
Yeah. And then E is for eye opener, like we talked about, using alcohol early in the morning to help with withdrawal symptoms or help with hangovers.
I've never had a hair of the dog.
Yep.
I tried it once. It was the grossest thing ever. I'll never do that again.
Yep. So that's your 4 questions. And that's the easy screening question. And that's where most like your primary care doctors will kind of ask you before going in. So you had 1, maybe 1.5, but it's something to consider and something to think about when you especially when you've tried to cut back, maybe that internally you think, you may be, using too much alcohol.
Yeah.
And that you need to kind of think about kind of cutting back a little bit and cutting down. And then you try doing that, through through kind of self-motivation.
Yeah.
Right. We talk a lot about motivational interviewing and what's important to you and health and finances. So if that's something that's important to you, and that's where those kind of dry Januaries and
Yeah,
other,
yeah.
challenges come in, is you'll kind of start to see of, hey, I can cut down. Hey, it does help my, overall health and well-being.
Right.
And that's going to be more motivation to not use as much alcohol in the
Yeah.
future.
Yeah. I find whenever I have tried to cut down, the hardest part is the social aspect because everywhere you go,
It's everywhere. Yep.
It's everywhere.
Yep. And then every restaurant you go to has that specialty drink that
Oh,
looks
yeah.
amazing. Right.
Oh, yeah.
Yeah. But again, now margaritas come in this like fishbowl, 24-ounce margaritas.
I think those are meant to share. At least
Yeah.
I hope so. All right. I have a couple of listener questions. Okay. Let's see. A bunch of kids at my college drink Borgs. Have you heard of this?
I have not.
Oh, Lord. Well, let's learn together. This is where they take a gallon of water, like a physical gallon of water, dump some out, and then put a fifth of liquor, typically vodka, into the mix with like some kind of flavoring packet. Most don't finish their gallon, but what are your thoughts? Is this safer in any way?
It is.
You don't think so?
No, we talked about those
Drinking
dealing with,
a fifth
and
of vodka?
we used to mix all kinds of cocktails in
Yeah.
5-gallon buckets, and
When you were in college?
college and
Purple Jesus is what we did around here.
Exactly. Yep.
Yeah.
Purple haze. We had them all.
Yeah.
And yes, they're very unsafe. A lot of times they have grain alcohol in them. A lot of times they'll have several bottles,
Yeah.
of
Yeah.
different mixology portions of it, and they're really harmful to you. Again, you don't know how much you're consuming. It's mixed in a gallon jug. You don't know how much you're pulling out of it.
Yeah, exactly.
And again, if you're drinking and consuming just that much,
That's bad news bears right
yep,
there.
Exactly. Yep.
What about drinking water in between drinks? Is that at all,
Nope.
have an advantage?
So some folks do get dehydrated, and when you drink alcohol, it is a diuretic. It does cause you to urinate more.
Yeah.
Water does help keep you hydrated, but it doesn't help metabolize alcohol any faster. What it does do, it takes longer to kind of drink a glass of water, and it's just time that can sober you up.
Gotcha. Yep. Okay. All right. The last one, just two. My parents were both alcoholics. Yeah. Does that put me, kind of covered this earlier, does that put me at a higher risk for alcohol abuse?
It does.
Is it only, I'm going to add on, is it because you're going to socially see them drinking or like physically see them drinking as opposed to physiologically, or both?
Both. So genetically, you have a genetic disposition for alcohol use, especially with 2 first-degree relatives having alcohol use disorder. So again, you kind of have that genetic component, and those genes can be expressed when you're exposed to alcohol. There's a lot of studies out there on the genetic components of it. But if she never uses alcohol, then her brain will never be exposed to it and maybe never become addicted to alcohol.
So maybe if you have alcoholics in your family, the best thing to do is never touch a drink.
Correct. Yep. That's absolutely correct.
Thanks,
so there's
Mom and Dad.
Yeah, there is nature versus nurture. We hear those terms a lot when we come to addiction. And that, part of it is what we see our parents do, socially, and we find that socially acceptable, and we do that as we get older.
That makes sense.
But also, once we do get exposed, to those substances, if we have those genetic dispositions, that switch flips in our brain, and then we have a very high risk of substance use and for alcohol use disorder.
Okay, so if for anyone who has any inkling that they might need help, where should they go?
It's always best to start, with your primary care physician. Most family practice and internal med doctors outpatient can provide support for alcohol use disorder and prescribe those 3 medicines that we talked about. Many psychiatry and mental health and well-being providers will also do alcohol management. A lot of times they have more resources as far as the therapy aspect goes. But again, if you start with your primary care, a lot of times they'll refer you, and vice versa if you have medical conditions from your alcohol use. If you have severe alcohol use disorder and maybe struggle with those withdrawal symptoms that we mentioned, sometimes you need kind of more acute care. And, a hospital is not a bad place to start if you really have, severe alcohol, or you have a history of like withdrawal seizures, and it's something that you can't necessarily stop just in the outpatient.
Even if they don't have a rehab center, if you're not sure that they have a rehab center in that hospital, just go to the hospital.
That's true. Yeah. And then there's in this area, there's Holly Hill, there's Triangle Springs, and there's some other kind of places you can kind of self-report to.
Okay.
So you can go to those locations. You can, Google search, and there's lots of different alcohol rehab centers that you can just go and self-report, and they'll do an assessment to you. And if you are medically stable enough to be admitted, they can admit you there. And if not, they feel you might need more higher level of care, they'll send you to the hospital.
Okay. Well, what I hear from you is that there's hope, and I love that. Like it may seem like it's the hardest thing, and it may be very hard to get through, but at the end of the day, you can do this. And if you have any inkling that you might have issue with alcohol, want to get dealt with, do it. It's going to be worth all the work you put into it. Thank you so much.
Thank you so much for having me.
Of course. I find it so interesting that even a short break from drinking can make a big difference in our mental clarity and how we feel. Remember the recommended daily limits: 1 drink for women and anyone who's over 65, and 2 for men under 65. And 1 drink is 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of liquor. It's not that much. Dr. Christopher Thompson was my guest today. You can find him at wakemed.org. There's a link to his quiz and an article he wrote about the Sober Curious movement in our show notes. If you have any thoughts on this episode, please share them with us. We'd love to hear from you. Go to WRALFM.com/SarahHasQuestions. Thanks for listening, watching, and most important, sharing this show with all your friends. See you next time.